Hemophilia is lifelong, but modern treatment has changed daily life dramatically for children and adults who have it. Hemophilia is an inherited bleeding disorder. One of the clotting factors that helps blood seal a wound is missing or low. The two main types are hemophilia A, a shortage of factor VIII, and hemophilia B, a shortage of factor IX. Doctors classify severity by factor level. Severe cases can bleed spontaneously. Mild cases often appear only after surgery or injury. Joints are especially vulnerable. Repeated bleeds into knees, ankles, and elbows can slowly damage cartilage over time. Diagnosis uses blood tests that measure clotting factor levels directly. Genetic testing can identify carriers within the family. The traditional treatment is factor replacement, infusing the missing clotting factor into a vein to restore clotting ability. Regular, scheduled infusions, called prophylaxis, keep factor levels high enough to prevent most bleeds before they start. Newer non-factor therapies like emicizumab are given under the skin, less often, and work even when inhibitors are present. Gene therapy is now approved in some countries for adults, delivering a working copy of the gene to raise factor levels. Physiotherapy strengthens muscles around vulnerable joints. Strong muscles absorb impact and reduce the chance of further bleeds. Low-impact activities like swimming, walking, and cycling are generally encouraged. High-contact sports are usually avoided. Home treatment training lets families act at the first sign of a bleed, which is one of the biggest factors in protecting joints. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.